Could you last longer in bed with a simple breathing trick? I'm going to share a quick and easy at-home technique you can use to last longer in bed in just a few weeks. As a urologist, I see a lot of men dealing with premature ejaculation, which is essentially ejaculating before you desire. Now, there's different definitions, but it's typically within 1 to 2 minutes of penetration. It's actually very common, and up to 30% of men experience it. That's not really just a physical issue, right? It can take a huge toll on your confidence and your relationships. And when you're constantly worried about finishing too fast, it's hard to be present and enjoy the moment, and it can create a lot of tension and frustration with your partner. So what causes premature ejaculation? Well, it turns out that the culprit is often an imbalance in the autonomic nervous system. Men with premature ejaculation tend to have higher activity in the sympathetic nervous system, which controls the ejaculatory reflex, and it can be triggered by factors like stress, anxiety, or pelvic floor dysfunction. But the good news is that we can influence the system through something as simple as breathing. The diaphragm and the pelvic floor muscles actually work together to regulate arousal and ejaculation. And a specific type of breathing exercises can help them work better. Now, most of the treatments for premature ejaculation are off-label. They include things like behavioral exercises like stop-start technique, where you essentially get towards almost climax and you stop and then try again up to 3 times and let yourself ejaculate on the 4th time. Sometimes it can include also grabbing the head of the penis during that stopping. There can also be things like delay sprays or numbing creams that you can apply to the penis. And then there's off-label medications. There's no on-label medication to date for premature ejaculation. But the good news is that there are actually breathing exercises that might be helpful. A new study looked at a combination of techniques that made a real difference. So in this particular study, the researchers took 62 men who had premature ejaculation and split them into 2 groups. Both of them received behavioral therapy and pelvic floor muscle training, both of which are pretty standard treatment options. So with pelvic floor muscle training, they learned how to contract and relax the pelvic floor muscles to help them sort of notice when they're about to ejaculate and control that reflex. They did these twice a day, 3 days a week for about 8 weeks. And they did 10 seconds of contractions followed by 10 seconds of relaxation for 15 reps. And then they did 1 second of contraction followed by 1 second of relaxation for 10 reps. They also did behavioral therapy, like I talked about before, the stop and start method. So essentially they did this to interrupt the buildup of ejaculation. But one of the groups also added in diaphragmatic breathing exercises. And here's how. Diaphragmatic breathing or belly breathing works when you sit up tall, place your hands on your lower ribs, and breathe slowly through your nose, feeling your belly expand. Then exhale slowly through your nose, letting the belly fall. And you want to repeat this 10 times twice a day. This deep, controlled breathing actually activates the parasympathetic nervous system, which counteracts the sympathetic overdrive that causes the premature ejaculation. And it can also strengthen the pelvic floor muscles, further enhancing the ejaculatory control. So after 8 weeks, both groups saw improvements because one group still was doing the other behavioral therapies and physical therapy. But the group that added the breathing did even better. And they measured intravaginal ejaculatory latency time, which is basically a measure of how long the man lasts during sex before ejaculation. And in the breathing group, that time increased from 30 seconds to 302 seconds. That's about 5 minutes after 8 weeks. That's a 900% improvement. In the control group, they did see an improvement, about a 690% improvement, going from 30 seconds to 238 seconds. So the breathing group lasted on average a minute longer. Now, the benefits didn't just stop there. The breathing group also saw significantly greater improvements in pelvic floor muscle strength and endurance. They were able to contract those muscles harder and hold for longer compared to the control group. And there was also some interesting changes in their autonomic nervous system. So they measured their heart rate variability, and the breathing exercises group saw changes that showed improvement in their heart rate variability significantly more than the control group, meaning that they basically boosted their parasympathetic nervous system activity, or the rest and digest parasympathetic nervous system. Having this breathing exercise actually improved the parasympathetic nervous system activity. And this is important because this activity helps regulate ejaculation. When you increase its activity, you are better able to control your ejaculatory reflex. So bottom line, what I want you to take away is that doing diaphragmatic breathing is likely going to help men last longer in bed. Specifically, if you incorporate doing these behavioral exercises as well as potentially pelvic floor muscle strengthening at the same time. So all of it without medications or without having to spray anything or put anything on your penis. And it's really free and it takes only 10 to 15 minutes a day. That is great. So I just want you to remember that you guys do have control over your sexual health a lot more than you might think. With the right tools and techniques, you can retrain your body and mind to last longer and enjoy sex without the stress of worrying that you're going to ejaculate too soon, without the anxiety related to it, and to regain your confidence. So I hope you guys found this helpful. And as always, remember to take care of yourself because you are worth it.